The frontal hairline is placed 1.5 centimeters above the upper brow crease. At the vertex transition point, hair changes direction from a swirl to pointing forward. A test is performed in every patient to see if they're candidates for follicular unit extraction. Here we see an individual follicular unit being removed directly from the scalp. The ease of extraction and the intact graft show that this patient is clearly positive. After the donor area is anesthetized and tumesced, a strip is harvested using 2 parallel blades set 1.2 centimeters apart. The blade should penetrate to mid-fat only. A scalpel is used to free the strip at this level with care not to transect the follicles. The strip is literally pulled from the scalp and can be seen having a uniform layer of subcutaneous fat at its base. The donor area is closed using a single running stitch of 5/0 monocryl. These absorbable sutures are placed very close to the wound edge with turns spaced about 4.5 millimeters apart. The strip is placed under a dissecting stereo microscope and sectioned into 2 to 3 millimeter wide slivers using a number 10 scalpel blade. The slivers are placed on their sides and carefully dissected into individual follicular units, with care taken to keep the units intact and to avoid the transection of follicles. The recipient sites are made in the frontal hairline with a 19-gauge hypodermic needle. At the hairline, the needle is positioned at a plane almost horizontal to the ground. As one moves toward the vertex, the angle starts to rise from the horizontal. As one moves laterally from side to side, it is important that the hair still points forward. Sites are made using a 19-gauge needle on a 3 cc syringe, but many different types of instruments can be used as long as the wounds are less than 1.5 millimeters. Here we see recipient sites as a density of about 20 per centimeter squared. Once the sites are made, the grafts are placed using fine jeweler's forceps. The grafts should be held at their edge or grabbed by the fat below the follicles. It is important that the grafts are always kept moist. Keeping some on the finger allows one to keep one's eyes in the area being planted. We rotate the teams of 2 to 3 placers so they can be focused and alert at all times.